Good morning, Chris from the Headache and Pain Management Centre for your Thursday, and a bonus video today. I thought I'd answer this question given that there was quite a few that have actually booked in the last week or so as a result of something that we put up on Google. And it's all to do with what's called tailbone pain, or what the medical term is coccydynia. Okay, so pain in your tailbone. It's a really uncommon, well, actually it's more common than you like to think, but actually really poorly treated condition. And I thought I'd just give some information about what causes it and some potential things that might be able to help things out. If you are joining us, type in below, say hello, and we can go from there. So tailbone pain. So people can get this. This pain is right at the base of their spine, so what's called their tailbone. So if we have a look at I've actually got a little skeleton behind us here. So there it is. So it's right down the bottom. There it is. So right at the bottom there, sort of just where your tailbone is. So where that pain can happen is when you're sitting down. Okay, so you're sitting on it and you're leaning back on it. Can really give a sharp type of pain when you're sitting right on it. You can also get pain when you're going from sitting to standing. You can get pain either right on the spot or around it, and it becomes really uncomfortable. Some people can also get pain while they're passing feces as well, or post-pregnancy is actually quite common too. So tailbones obviously don't move, they're fused. There's actually no movement there. So what is it that's causing this pain to actually occur? And that's what I'm looking to answer today. So there are a couple of things about tailbone pain that you need to know. So the first one is with tailbones. Actually, what the purpose of the tailbone is for muscle attachment and ligament attachment. So you've actually got a whole stack of muscles that connect into the tailbone. They're called the pelvic floor muscles, and basically what they do is they control everything to do with your pelvic floor. So passing urine, passing feces, and they also act as a bit of a sling to stabilize your spine as well, to keep you moving and keep you active. So when you've got a muscle attachment into that bone and those muscles are tight, what can happen is it can cause a bit of a pulling on the bone itself. Okay, kind of like, you know, it's not strictly this, but it's almost like a tendonitis when you've got other muscles pulling on the bone, and it just causes a bit of irritation where the muscle attaches into the bone. So sometimes when you get tailbone pain, it's a little bit to do with muscles being very tight within the pelvic floor, and that can happen as a result of pregnancy. It can happen as a result of some other issues as well. So often the treatment to that is actually teaching some muscles how to let the muscles go, and some really specific muscular exercises to get things going. Nikki here is our resident women's health and pelvic health physio, so she's got some really good ideas about how to do that. So that's the first and most simple one. The second one is referred pain. So you can actually get referred pain into tailbone from a number of different things. So the first one is actually from around L5-S1. So you can actually get referred pain from a disc at L5-S1 if you've got a disc issue. It can refer pain south into that area. So it feels like that the pain is in your tailbone, but it's actually coming from a different area. Another place or another thing that can refer the pain into the tailbone is what's called the pudendal nerve. Now the pudendal nerve is a nerve that comes out right down low, so out of your sacrum. So if we're looking at the picture, again we haven't got the nerves on this one, but if we're looking at the picture here, it's coming out of sort of right down low here, these little holes here, 2, 3 and 4, comes out of that. Okay, so that nerve can supply down into the reproductive organs on both males and females. It can go into as well a little bit of a pull down the back of your leg on the inside of your thigh, and also in and around your tailbone area too. So if you've got a nerve irritation around that pudendal nerve, you can actually get referred pain into the tailbone or coccyx from there as well. So the treatment of that is actually getting the nerve moving properly, getting the sacroiliac joint, which is just above it, moving a little bit better as well, and getting some exercise and strength around that area to get things going. The third thing that we find also can contribute, and this kind of combines all of it together, it's a muscle called iliopsoas. Now, this muscle doesn't attach directly into the coccyx itself, but it does have a lot of impact on all of the structures around the coccyx and the lower back, which in turn then causes the pain to happen. So when you've got tailbone pain, what we always check is the iliopsoas muscle, and that muscle itself connects from T12, L1, 2, 3, and 4, and crosses the center of gravity into the front of your hip. So if you've got a tight muscle there, what happens is that disc can get a little bit sort of, the movement of the L5S1 isn't all that great, so the disc can get a bit upset, and therefore it can cause some pain into your tailbone. Alternatively, if it's tight through psoas, it's tightening things up, then what can happen is that the other muscles tighten up too, because it's not able to move properly. So if it's tightening your pelvic floor up, then it can cause some tailbone pain as well. So they're you've got to look at all the other things that can cause these secondary issues where the tailbone pain is what you're experiencing, but it may not actually be the root cause. You've actually got to look at everything else that comes with it as well. Of course, the third one, and this is an obvious one which can often happen, is actually a fall directly onto the tailbone itself. A fall right onto your backside. And what can happen is you can get a big bruise sort of around the bone there, and it causes quite a bit of pain. Now, what the issue is with bruising is that sometimes it can just take a bit of time to settle down, and quite often, more often than not, when you do fall onto your tailbone, the bruising just sorts itself out and things get better. Now, if it doesn't get better, then it may not necessarily be the impact of the tailbone that's causing the pain itself. It's actually the secondary compensation mechanisms that happen when you fall onto your tailbone. So obviously if you're falling straight onto your backside, it's giving a really big jolt through your system. So your system gets a little bit scared of moving again. It's trying to prevent you from A, falling over again, and B, it stops moving because it hurts a bit. So it's actually that lack of movement and that compensatory mechanism that's causing the pain to happen. So sometimes you can fall directly onto your tailbone, it bruises and it causes pain, but then the bruising goes away and the pain's still there. So the pain can actually come from the secondary things like what I was talking about before, lack of movement, a psoas issue, the muscles around your glutes and your SIJ that causes the pain itself. So when you do have tailbone pain and the doctor looks at you and goes, well, I don't know, just sit on a donut cushion, like a lot of them do. Basically what you need to do is have a good look around the lumbar spine, have a good look around your pelvis and your hips to see what the deficits are, because a lot of the time it's actually lack of movement around that area, the tailbone and the coccyx, that's causing all of the issues. And of course, a really good questioning process about how it all started will give us a really good idea about what to actually start with. So obviously if it was postnatal after birth, then it's more likely to do with the pelvic floor muscles and getting some strength into that. If it's falling directly onto the backside, onto the tailbone, then it's more to do with an impact injury, and certainly if it's within sort of immediate afterwards, it's probably a bruise. And if it's any longer than that, then it's more likely to be a musculoskeletal thing. It's more likely to be an issue with the muscles and the joints surrounding the coccyx, where the coccyx cops the brunt of it, where it be from a referred pain or because of the muscles pulling on it in the first place. I hope that's been really helpful. We treat a lot of people with tailbone pain here. I've had it myself, so I know that it's not that pleasant. You need to move around onto one cheek or the other to get sitting. Sometimes it can be debilitating. You can't sit in certain car seats, can't sit in certain seats in the office. Movie theatres are really nasty, and it's just really, really uncomfortable. So getting on top of tailbone pain is actually really important, because, hey, sitting is actually really important in our society. So if you're not sitting comfortably, then it's really, really inconvenient. If you've got some issues with tailbone pain, just type in below coccyx and we can get in, or tailbone, and we can get in touch with you to see if what we offer can help you. If there's any questions as well, just you can type in below and we can answer those questions for you. Plus, if you've got any other suggestions about what can go on Facebook Live, happy to answer those questions for you as well. Hope you're enjoying your Thursday for this bonus video, and I'll be back with you tomorrow from Melbourne. It looks like it's going to be apocalyptic down there tomorrow, but we'll hopefully keep warm, and it'll be from a meeting down there. Cheers, take care, and bye for now.